counseling students, welcome to the last chapter, chapter 14, skill integration, determining personal style and transcendence. All right, so our final awareness and knowledge, you are going to review theories emphasized throughout the book. Note that detailed reviews of crisis counseling and cognitive behavioral therapy were presented in the last chapter. You're going to review and integrate concepts, skills, and strategies learned in previous chapters, explore a pre-interview checklist to help ensure that critical points are covered in the first session, and understand the place of case conceptualization, treatment planning, referral, and relapse prevention, closely related to action planning. You're going to have the ability to create long-term treatment plans with clients and keep systematic records. It's really important when you create a treatment plan. The treatment plan is the plan over the course of your therapeutic alliance together. Goals can shift, goals can change, but you want to make sure that if a client has worked through something in their treatment plan, note that, and then you may have to tweak that. Do they have new treatment goals? Or maybe they go into a maintenance plan where they're now seeing you once a month, or maybe they're now seeing you as needed. So you just want to make sure that you are keeping your treatment plan up to date. All right, so have the ability to increase client take home of thoughts, feelings, meanings, and behavior in the 5th stage of the interview through action planning and relapse prevention. Now, again, I say session. Interview to me, too technical, but to each his own. The ability to record and analyze your own sessions. Again, if you're going to record something, you have to get permission of your client. I mean, in an actual real session, I don't record anything. But if you're using it as a teaching tool and the client is okay with that, then obviously you have to get written consent. All right, and then compare counseling style with that in earlier recorded interviews or sessions. I'm trying to use the book term, but I do not use that in my own practice. All right, ability to work toward defining your unique personal style and what you wish to see happening as you work with others. All right, so with skill integration, integrate the micro skills into a well-formed session and generalize the skills to situations beyond the training session or classroom. And by doing that, what the anticipated result, would be is developing sessions, right? Interviewers. So, interviewers, when I think of interviewing, that is an assessment, maybe, right? It may be where you're doing a one-time assessment and done, or an assessment and then referring out. Because it's so impersonal, it's not, so that's the reason I don't jive on that word. Okay, so we want to make sure that your style feels natural, and my style is natural, so I am unable to use the word interview. All right, so each of us will vary in our choices, but increasingly we will know what we are doing, how to flex when we are doing when what we're doing is ineffective, and what to expect in the interview, I say session, as a result of our efforts. So sometimes things aren't gonna jive, right? You're gonna be in a session and you're gonna think sometimes like, I think I'm gonna ditch this. I'm not gonna do this. I'm gonna change it to that. So we want to make sure that we can flex that. All right, so with philosophy, let's be practical and find something that works. Find something that works for you and your client and that session. Every session is going to be different. So we want to make sure we're not using CBT just because to use CBT. All right, so key methods and strategies, 5-stage decision structure plus micro skills, implications for your practice, whether you favor person-centered, like I talked before in the last chapter. Person-centered is awesome. It's a good starting point, good to build trust, not necessarily good to stay in, because person-centered, there's not a lot of growth there. So we need things that are going to help our clients grow. So whether you fancy that or CBT or some other system, there's so many, they're all going to require you to make a decision. And it's going to require that your client has an action plan. All right, so clients are the experts in their own life story and direction. This is the reason we're not advice givers. They know what they need. Maybe they need a little push. Maybe they need a little pull. Maybe they need a little questioning, but ultimately they come up with their aha moment, or they're supposed to. Personal self-actualization to reach one's full potential. If they're discovering this and it's not something we're telling them, then it's going to hold longer. It's going to be more sustainable. Key methods and strategies: relationship and empathetic understanding, the centrality of emotion and emphasis on listening. And then implications for your practice. Regardless of your chosen theory, listening, that's go-to. Listening is going to be the number one thing that helps your client, because when you're listening, you're able to provide insight and input. All right, so life always has meaning. Maybe we're not in understanding of what that meaning is. It doesn't negate the fact that life has meaning. Discerning what we care for, what we are about, and our life's meaning and purpose seems to transcend all other issues. And the implications for your practice: exploring meaning can be particularly useful in crisis situations. So anytime you're really exploring meaning, that is going to help you when you are in a situation where there's a crisis and you need to be right there for your client. All right, so you're noticing there is a trend: philosophy, key methods and strategies, and then implications for practice. All right, so in this issue, or in this slide, we're now looking at multicultural counseling and feminist therapy overview. And before it was counseling and psychotherapy logotherapy overview. So sorry, I didn't highlight that. Okay, so when we're looking at this philosophy of feminist therapy, both multicultural counseling and feminist therapy rest on a foundation of the cultural environmental context. So that philosophy centers around that foundation. So it's very key to understanding, oh, this is the philosophy, so now I'm going to implement these strategies based on that philosophy. So hopefully now this is kind of coming together. So both focus on raising personality consciousness of how the individual develops in a cultural environmental context. And then the implications for your practice is that, remember, the clients, regardless of their race, their ethnicity, their gender, their background, how much money they have or not have, they have a cultural background. People will say, like students, I don't have a cultural background. Yes, you do. I think we think sometimes we think differently. You have to look at what is the definition of culture. When you understand what culture is, then you'll understand that we all have cultural backgrounds in history that affect their identities. So when talking about our clients and all the issues that they may be facing. All right. Empirically supported relationship factors. So learning identified relationship building skills to enhance the therapeutic relationship, as well as effective means of adapting the therapeutic relationship to the individual characteristics of the client. A process known as tailoring or matching can improve your work. So that was very wordy. So learning how you can build these skills and identify these things to lead for effective change, will improve how you work with your clients. So the therapeutic relationship, that's important, right? Because we have to have that relationship, that collaboration, that trust in there. Because if you look here, it accounts for clients' change more than a particular method of treatment. So what that is saying is that it's more important to have that relationship with your client, not about what you know. I got to figure out what to say. I have to know this. I have to know that. They need to know they have a place to land and a place to trust. Everything else falls into place. So all the theories discussed in this chapter build on relationship. No matter what, every theory, whatever, you have to have a relationship first. All right, so part 2 of this: factors known to improve the quality of the therapeutic relationship. Empathy. Empathy is number one. Empathy is with everything. Goal consensus and collaboration, positive regard and affirmation, alliance ruptures, and managing counter transference. Sometimes you're going to, clients are going to transfer certain emotions on you, and it's very possible that you could do that onto your clients as well. So we have to be careful of that. Factors used to tailor therapy to the client's characteristics, reactance level, stage of change, preferences, culture, coping style, and religion and spirituality. All of those come into play when you are tailoring a specific therapy for your client. All of these adaptations and accommodations are useful for counselors or therapists at all levels of training or professional work. They are trans-theoretical. They can be applied by counselors and psychotherapists from different theoretical orientations, and they can be applied by many different professionals. All right, you have reviewed your personal style and current theories of counseling throughout the book. The theories presented here represent different ways in which counselors and therapists understand human behavior and challenges. And if not, you better go back and reread it, or just relearn some things, or maybe learn new things that you might have skipped over. There are many more available. Learn from as many as possible, but most probably you will establish your own personal style and theory over time. Again, this is going to be, if you're going to be doing this as your career, it's going to be lifelong. There's no moment where you're like, I got it now. I've got it all figured out. No, you're going to consistently learn new styles, new theories, new homework patterns. You're going to make up your own stuff. So this couldn't be more true in here. That learn from as many as possible, but you're going to establish your own style. So that's what's so great about therapy and counseling, is that it's not black and white. You get to have your own style. You get to have your own homework. You get to do things how you want to do them in your practice that you can adapt to with your client. All right. 4 major factors to consider as you move toward identifying your own personal style and integrating the many available theories. So first, your own personal authenticity. Who are you? What style do you have? What works well for you? What is easy for you? We've talked about what things might you look at, what things might you avoid. Some things you might avoid in the beginning might be because that's uncharted territory. So I need to learn that more before I start utilizing that. So something you're not using right now, you might use that in a year, 2 years, or 3 years from now. The needs, goals, and style of the client. So those are factors to consider. The context and multicultural, social justice, and advocacy needs of the client. Again, every client is going to be different. Their needs are going to be different. They might be in the same cultural background, but have very different ways of viewing that. So again, it's really important that you are personalizing this for your clients. And then your own life goals, values, worldview, vision, and wisdom. It's very important to know these things before imparting your thoughts onto other people. All right, so unless a skill or theory harmonizes with with who you are, and your sense of meaning, it will be false and less effective. So with that said, that just means if you are going to use a technique or theory that you're not agreeing with, that you don't like, then it's going to be less effective for your client because they're going to feel it. So you have to work within theories that you can really identify with. And under the umbrella of CBT, there's going to be so many different things that you can utilize. Some you may not use, and others you're going to use like all of the time. So just know your own personal style. All right. Competence, caring, and sense of direction and purpose are essential. All right, so determining personal style and theory. So as you work with clients, identify your natural style, add to it, and think through your approach to interviewing and counseling. Examine your own preference or preferred skill usage and what you do in the session. Integrate learning from theory and practice in I know it keeps saying interviewing, counseling and psychotherapy into your own skill set. So it's good to borrow from different things and personalize it and make it your own. That's what counseling is. That is the reason, full circle moment, counseling is an art. From the beginning of what we talked about, this is the reason counseling is also an art. So if you do these things, then the anticipated client response is that you, as a developing interviewer, I like that word, or counselor, therapist, psychotherapist, psychologist, whatever, will identify and build on your natural style. So you will commit to lifelong learning in this process and constantly learn new things. You're going to learn new theory and you're going to practice that when you're, when you're assessing people. Okay, so learning about theory and practice will while evaluating and examining your behavior, thoughts, feelings, and deeply held meanings. All right, so importance of case conceptualization and working formulation. Your understanding of your clients, their issues, and the decisions they want or need to make is foundational to your work. A case conceptualization is an individualized application of your theoretical model that takes into consideration the antecedents of the case and your observations and inferences. So when you're thinking of a case, conceptualizing a case, this goes with you. This is something that's individualized for your practice and how you understand a theory, and then how you take that into your practice and understanding what issues kind of brought them there, and then how can we observe these things and help them make those positive changes. The data to be considered include what you may find in the intake file, information from ongoing sessions, and then other sources like outside sources. Maybe they're referrals, maybe they're old doctor's notes or old case notes, or whatever the case is. You want to consider all of the data. A case formulation will be produced based on all of the information. This formulation will be the working hypothesis used to guide treatment, and it will evolve over sessions. So new things are going to emerge. They're going to evolve. You're going to learn as your client tells you more information. And then with that, you're going to be able to guess, oh, this is probably how they might act or react if I give them this. So you're going to keep building on and building on. A working formulation will help you make decisions about the treatment plan, select interventions, assign homework, cope with setbacks, because ultimately we're going to have those, assess outcomes, determine paths to action, and complete treatment. And then when you look at, the book in general, Alan's work with Mary illustrates many of these concepts. So you'll see that in the book. So the first session plan and objectives. So before your first session, you've already done a mock session. So stage 1 is empathetic relationship. You want to make sure that you are present, you are putting yourself there. That's key. That's number 1. You want stage 2 is story and strengths. Listen to the story, listen to everything going on, utilize their strengths, and make sure that that is what you are focusing on. They're going to give you all of their weaknesses. We want to focus on what is working for them. And then you want to have your goals. You want to be able to do the restory. And then finally, that stage 5 is the action. That's where we put everything into an action plan. All right, so referral. Let's talk referral. So referral, no interviewer, right? We know I don't like that word. Counselor, therapist, whatever you want to call yourself. We don't have all the answers. Sometimes we have to ask for help. Sometimes we need to reach out to a mentor, to a colleague to help us with a case. Referral helps clients find community resources for their continued growth. Referral helps when counselor skills are insufficient to aid the client. Maintain contact with the client as the referral process evolves. So if I'm working with a client and I say, it sounds like medication might be, something we need to explore. So then I'll give a referral to, a particular psychiatrist. Or if a psychiatrist in the local area is booked, I might refer to ZocDoc, where a client can, get that help almost immediately. So that's part of your work, is referring out, because there are going to be things that are not in your specialty that you need help with. And you want to ask your client, how did that go? How did that referral go? How did that appointment go? Continue to work with the client while additional help is acquired from specialized professionals. All right, in your treatment planning, in the form of specific written goals and objectives is increasingly standard. So any counseling endeavor you take on, any client you have, there has to be a treatment plan. A treatment plan is not just writing of words. It's basically a template that includes goals, what the problem is, the interventions, how are we going to tackle those, and how are we going to know that those have all been completed. So you want to make sure that what you're following is kind of the acronym SMART. So you can go ahead and look into that. Treatment planning is often required by agencies and insurance companies. So if you're working in an agency, you have to have a treatment plan. If you're going to work and take insurance, you have to have a treatment plan. So it's really important to understand what that looks like. And everybody's treatment plan is different. You can create your own treatment plan, but just know what needs to go in one. When possible, negotiate specific goals with your client. Collaborate with them. You might have a goal for them that they're not seeing. They may write out their goals and you kind of tweak them to where it's put into, like the plan as something that's actionable. So they might say, I want to do this and that. You may have to kind of shorten that up. That's why you want to collaborate with them and say, hey, does this sound accurate? Write concrete and clear goals. That's where things are black and white. We have to know, what are the goals? What do they look like? Include specific indicators of behavioral change and emotional satisfaction. That might be scales. So when you first started therapy, you were very anxious. You were like at an 8 or 10. What's your anxiety level now? So we want to see that we can measure change in our clients. All right. Maybe structured using the 5 stages, includes highlights from each stage, summarizes the issues, includes decisions, interventions, and shifts in topic direction, and captures generalization and homework plans. All right, case management. That requires the professional helper to coordinate community services for the benefit of the client, and very often the client's family as well. So if you're maybe doing family counseling or couples counseling or anything where there might be multiple people, that's where you might need to, coordinate those community services. So you might be referring out to a family therapist, or whether maybe substance abuse, maybe it's, a group session. And so referring to the proper people or professionals will be key to know. All right, counseling and therapy are an important part of case management, but it's only a part of that. Advocacy action, as we have talked about before, that's important throughout your counseling relationship with your client. Many communities and agencies, not all of the necessary services may exist. Equally or more likely, they may not work together effectively. So, for example, some people, they want to go to AA and counseling at the same time. Sometimes it doesn't work for them doing too much together. And sometimes whatever they need is not local. So we have to, help and adapt with those things and go into like a step kind of program. This may require organizing to produce change. So again, we may be doing all of the legwork initially before we really get to know our client, in making those suggestions. All right. Relapse prevention, that's, huge in substance. So we want to have a relapse plan for any of our clients that have any substance abuse issues or addictive issues, gambling, pornography, whatever the case is. So relapse plan is developed to reduce a client's slips or relapses. If a client has a slip or a lapse, that's not considered a relapse. A relapse is when it continues. So we want to make sure that we are using our words correctly as well. The maintaining change worksheet is completed with the client to help prevent treatment lapses. So again, if you're using a very particular worksheet or template, you want to make sure that that is consistent. And then anticipate possible obstacles to treatment. You want to kind of foreshadow this could happen. We already know that with, especially alcohol and substance abuse, the relapse is really close to 100%. So we need to know the obstacles to treatment and the obstacles to relapse, and really honing in on what can we do to minimize those obstacles. How can you help your client with that? And then include strategies for treatment success. So we want to make sure that we have a lot of tips and tricks up our sleeve. All right, transcribe the session and use what you have learned so far to fully analyze your work, consultation, referral, and treatment planning. This is where your mock sessions come into play. And so beyond this course, it'll be important for you to still keep up with, utilizing and having your own mock sessions or trials, or, with a friend, a family member, who, whatever you want to do. All right, conducting and transcribing a full session. So the final audio or video session that you're going to complete, we want to look at cultural, environmental, and contextual issues, evaluation of your work, your current natural style and expertise. Again, that's what I'm looking at, is your natural style. I'm also looking at what have you learned since the first session, from everything you've learned in the text, in the lectures to now. Compare your current performance with the recording of your first session, and look at that. And instead of saying, like, oh, I was terrible at this, look at how you've grown instead. It's more important to focus on growth and not setbacks. Because if you're going to be the counselor, therapist, whatever you want to call yourself, it's going to be really, real important that you're not downing yourself. Because again, what we tell ourselves is the truth. So we want to make sure that we're kind of, we're meeting our own needs. It's in our own truth. That's important. All right, so the transcripts and your portfolio of competencies can provide a permanent course summary for you. It's really good to have this. So when you do your final e-binder, your e-portfolio, it's a good thing to save. So if you're applying for practicums or internships, you can say, this is all the knowledge and skills that I've gained in my counseling course. So it's good to have that. Even if you have a binder, like an actual binder, it's good to hand someone or a potential employer in an entry-level position. At the level of personal skills, reflect on your confidence level in each of the major micro skill areas. Use the self-assessment tool provided in table 14.1 to guide your reflection. And you may also use this as a summary and as a plan for your future growth. You have come to the end of this phase of your counseling and psychotherapy journey. So we are in the final chapter. We are end of the term. You can use all of this to do your final session. You've had the chance to learn some foundational skills and how they're structured in a variety of theoretical and practical approaches. Skills that may have seemed awkward or unfamiliar, especially in your first session, might now feel a little more automatic and a little more natural. The basic listening sequence is likely part of your being at this point. So you're now noticing in your own conversations with people that you're stopping and you're reflecting. And that is because you've had some practice. Expect that the empathetic relationship, the story and strengths, the goals, the restory, the action framework will become a very useful part of your practice, enabling you to adapt and work with many different theories of counseling and psychotherapy. Again, we've only just really scratched the tip of the surface with counseling. There's still a lot more you're going to learn. There are 4 major factors to consider as you move towards identifying your own personal style and integrating the many available theories. So authenticity, competence, caring, and a sense of purpose in the meaning of life. Those are going to be essential. All this needs to be done with awareness and, of course, with the cultural environmental context. So remember, everything you go into, there's going to be a cultural component to that, some environmental component to that. So multicultural understanding is going to be essential. And we have to remember all cultures are different. Just because someone is of the same cultural background does not mean that they're not going to, look at something different. So we just have to make sure that we're not pigeonholing and we're not just puzzle piecing people together. And then reflect on these issues as you continue the process of identifying your natural style and future theoretical practice integration of skills and theory. All right, so summarize your own story of interviewing and counseling. You may want to base it on your micro skill practice exercises, or this may be something that you no longer look at and now you're going to adapt to something else. So again, you have to make sure you're doing what's right for you. What have you learned by completing all of these exercises? What can you say about your natural style up to this point? Where would you like to go next? So that's really important. Now that you've had this class, where do I want to go moving forward? Is this for me? What do I want to learn more about? So whatever comes to mind as the first thing, I would focus on that class. Counseling and psychotherapy are noble and altruistic professions, so we have to make sure that this is something that you really want to get into, that you could see doing this long term. Because like I said, you have to have a master's degree for this or a doctoral degree. So before spending money and time and investment, make sure this is something you want to do for yourself. The ultimate goal is betterment and well-being of individuals, groups, and society. So people that you come into contact with. Transcendence is going beyond ourselves. So if this is the type of, what's the word I'm looking for? Profession that really sits with you, then okay, I want to explore this more. Becoming an effective counselor or a therapist is a fantastic goal. But we do believe the ultimate measure of your success, of our success, is the success of others. So again, we're not going to take everything our clients do or don't do. That's not about us, but we want to make sure that what we're providing our clients is essential for their success. They're the ones that are in charge of doing it. So showing up, going to sessions, all of that, that's on them. But we have to make sure we're doing our part. All right, so transcendence. This is a little bit of a long chapter, but we're getting close to being done. So transcendence, again, that's in Maslow's hierarchy, right? Transcendence is like far beyond us. So that speaks about your capacity to go beyond yourself and successfully apply your newly mastered skills to help others. The ultimate test of your capacities is the benefit that you can afford to others. So your growth is fantastic. It's great, but helping others grow in their therapeutic journey, that's the icing on the cake. And so in doing that, the anticipated client response is that they're going to perceive your genuineness. They're going to perceive that you really care about their goals and what they want to do, and that intentional, piece that you put in there. And that allows for that collaboration. Trust in the relationship will increase. Clients will benefit more from working with you, and their meaning and life vision will become even clearer because of how well, you were able to collaborate with each other. All right, so now we end with, you've learned a lot about skill integration, multiple counseling approaches. And again, I really don't even think that you've learned a lot of counseling approaches. I think we've learned some. There are so many other approaches, and you're going to learn that in your theories class. You've learned about case conceptualization, planning your first, actual real session with a treatment plan, using that checklist. And then you've learned about referral, when you need to maybe refer, and then case management. And there's no portfolio of competency. Well, actually, there might be an ending. Is there the ending one? I don't even remember. But this is kind of our nice done wrap up. This will really set you up for that final mock session, and it will set you up into really honing into the next set of courses that you want to take, or if you even want to take any. So hopefully you've had a nice ride, you've had a great journey through basic counseling, and you will now decide if this is for you. And I hope it is, because it's an amazing career. And I wish everyone all of the joy, the luck, the success, and you know where to find me. All right, peace.